Afternoon, everybody. Sorry, it's morning. Thanks to everybody who's joining us remotely. I want to begin by acknowledging we're on Treaty 1 territory in the traditional homeland of the Métis. I'm joined today, as always, with Jay Shaw. He's the Assistant Chief Emergency Management. We've seen in the province of Manitoba over 2,000 new cases since Sunday alone, with 29 reported deaths to date. Message I want to begin today's press conference with is pretty simple. Stay home. Don't gather with people that you don't live with. Now is not the time to have friends over. And if everyone doesn't gather, we know that less COVID-19 will be spread in our community and throughout our city. If you're able to work from home, please do so. If you're not able to work from home, please go straight to work and come straight home afterwards. If every Winnipegger puts in this effort right now and makes these sacrifices to our everyday lives, we will flatten the curve once again. Stay home, and while you're at home, support local. Order delivery, support our local businesses at every opportunity if you have the means. If you're starting to look at gifts for the holiday season, I'd encourage you, and I encourage all Winnipeggers, support our local businesses, especially those that aren't able to physically open right now. Just because the provincial public health orders allow you to go to larger stores that sell groceries and also retail, I'm encouraging Winnipeggers, save those retail dollars for our local businesses. Go online and order from a local business. Do it this weekend if you can. I'll be ordering takeout once again tonight, and I hope you'll consider doing so as well. I'd like to provide a brief update on enforcement activities being undertaken by the city under the direction of the province of Manitoba. All data relating to the city's ongoing enforcement activities are updated daily on the city's open data portal. Jay Shaw will provide you with a more specific update in a few moments. I'm urging Winnipeggers not to let it get to the point where tickets are required, though. We'll be in a much better position if everyone is proactive and reactive measures like enforcement aren't required. For the instances where enforcement is required, however, I want to remind Winnipeggers that they can call 311 to report violations 24 hours a day, 7 days a week, and you'll get a live person. I really want to just emphasize the importance of checking in with people you care about while not gathering in person. I know residents right now are anxious, and moving back into heavier provincial restrictions are unnerving and stressful for all of us to differing degrees. But I want to just remind Winnipeggers, we will get through this. We will weather this storm. Please make use of video conferencing if you can to reach out to those that you know and you care about. Use the phone, use FaceTime, do whatever you can safely to simply check in on friends and family that you care about. And I know that there's an added layer of pandemic stress in everyone's lives right now, so we have to keep tabs on our mental health and the mental health of those that we care about. Be safe, be well, and be at home. Thank you very much, Merci and Miigwech. I'll turn things over to Jay now, and then we're both available, as always, to answer your questions.
Thank you, sir. Good morning. My name is Jay Shaw. I'm the Assistant Chief of Emergency Management for the City of Winnipeg. Today, I want to reiterate the importance of following public health advice. When you take precautions and listen to the advice of professionals, you are helping to save lives. I don't think I can stress this enough. We need to stay home. By staying home, washing your hands and wearing a mask, you're helping to save lives. For those of you that are doing your best to follow the advice, I want to thank you. I know many of us are struggling with the stay-at-home message and are worried about our mental health as we're dreading the thought of a cold, long winter ahead of us. But it's also important to remember that outside isn't closed, and your mental health is important. You can follow the provincial health orders while still getting outside. Fresh air and sunshine are good for everyone. This doesn't mean that we gather in groups or meet friends in the park. This doesn't mean that we organize groups to walk together. This simply means take a break, get outside, move your body. Learn to embrace the beauty of Winnipeg and all it has in all its seasons, including this upcoming winter. Finally, I would like to recognize the work of our bylaw enforcement officers who quickly adapted to a new role, enforcing a select number of public health orders. We have completed our first week of targeted inspections within Winnipeg. Over the course of the week, our bylaw enforcement officers have inspected 159 facilities. As we have mentioned previously, they handed out 2 warnings to individuals for not wearing a face mask. To date, they have now issued 2 tickets to businesses for not being in compliance with orders to close. As the public health orders change, we are continuing to work with the province to determine where they feel our bylaw officers and our bylaw enforcement officer efforts are best suited to make an impact in the city. Possible violations of the public health orders can be reported by contacting 311. We will now take your questions.
Abdoulaye from French CBC. Abdoulaye?
Hello, can you hear me?
Yes.
Yeah, I don't have a question at this time.
Thank you. Alicia from Global.
Good afternoon, Mayor Bowman. You and Jay both talked about mental health, but how are you two handling your mental health during this time? It's got to be stressful, probably more stressful than the average citizen right now.
I'm not sure I would. I appreciate the question. I'm not sure I would agree. I think with our stress being different, I mean, it's a different role. It's public, but I think I'm thinking these days, and when I'm at home in the comfort and safety of my home, I'm thinking about our healthcare heroes right now and the stress they must be feeling, literally on the front lines of dealing with COVID. So, I think everybody, these are unusual times for everybody. I think a lot of folks have stress related to their financial security, their own health, and the health of people that they care about, and just the overall health of our community. I am getting out more often with my family. We started hiking in the summer, and in the last couple of days, we've been out to Assiniboine Park just to go for a walk and check out from a distance the construction of the diversity garden. We invested in bikes this summer, and I'm hoping to do some winter cycling this year. But we're getting outside. I'm fortunate to have a really strong support base of colleagues here at City Hall, both on council and in the public service, and my own staff and family. We're doing what we were hired to do right now. So I don't have any complaints. This is what we were hired to do, and we're doing our best that we can along the way. I am watching a lot of Netflix with my kids. I've got King Kong to watch tonight with them. We started last night, but it's 3 hours. We couldn't make it past their bedtime or mine. So we're trying to have fun, and we're doing a lot of cooking and baking and things like that as a family, just to have fun, and a lot of FaceTime with friends all over North America.
You talked, I know when level red came down and the closures were announced, outdoor rinks were on the list of closures. Any chance of maybe opening those up again? It's outside, people like to skate, and that seems like a fairly safe activity to do so long as you're not in big groups. Is that something you might consider in the future?
So I think we need to follow the public health advice that is coming down, and right now those have been slated for closure. We are going to make sure that we're ready if they are able to open. We're about to go through a period of time right now in this code red, if it's 2 weeks or 4 weeks or 6 weeks or however long it takes for us to collectively come together and hammer down this virus again so that it's flat. But we are actively working in the backgrounds with our community services group. We want to make sure that we can be able to provide those services as soon as we can. Our government, the municipal level government, is the closest level of government to people in a lot of ways. And we recognize, and you talked about mental health, we recognize that those services are super important, and we want to make sure that we can deliver on that. But right now, the message is to stay home, and we're going to follow that advice. I'll be doing that this weekend as well, and I encourage Manitobans and Winnipeggers especially to stay home.
Thank you.
James from the Winnipeg Sun.
Yeah, good afternoon. I've seen some pictures on social media of full parking lots outside of large retail outlets. Do you think people are taking this code red seriously?
I'll jump in just real quick. I think they are. I think what happens right now is that we have to process new information. So what happens is we take a little bit of a shock to the system, myself included. We're going into code red. What do we need to do to get things stabilized? So you're going to see people a bunker down over this weekend. There may have been some people out there making sure that they had all their essentials and groceries and things like that. People are just starting now to change their routines through this code red and make sure that they're getting ready to hunker down and follow the public health advice of staying home. So while I encourage everyone to shop local when they can, we are still going to see people needing groceries, people needing to go to the pharmacy, and people needing some essential items. But the general message, stay home, shop local, take care of your family, take care of each other, get outside for brief walks, get some exercise, and again, let's make sure that we're working together to flatten the curve.
The one thing I'll just add to that, James, is I've seen those images as well, and I know which ones you're talking about. There's provincial public health orders that need to be complied with, but then there's also additional measures that Winnipeggers can take. And so I mentioned in my opening comments about just because some of these big box stores might be open for groceries, but also for retail, doesn't mean you should take all of your kids to that store this weekend to buy toys. I understand, obviously people need to get groceries, but if you can save those retail dollars to support local, many of whom have online activities that you can purchase those toys or other products that you don't need immediately this weekend, like groceries. I'm just encouraging Winnipeggers, they have that power and that discretion to do that. Just because the health orders permit some of these big box stores to be open for products that for many local retailers, they've been shut down. You have that power in your hands, in your pocket, in your wallet to be able to support local and do it in a way that mitigates the number of people that are out.
Thank you.
Jeff from CTV.
Hi, I'm just wondering if there's any update on potential for redeployments or layoffs, and obviously thinking of libraries, community services, that type of thing.
Short answer is Public Service is still reviewing the provincial public health orders to assess their implications on our staffing and our operations.
Thank you. We keep getting a lot of emails and calls about transit, because while we don't know about transmission per se, the list of exposures is quite lengthy. I guess that would be expected because a lot of people take transit. Are there any plans to, ramp down transit again and try to keep people off the bus, or with now another lockdown, or adding more to spread more people out? Like, are there any plans to do anything with transit?
Short answer is no, but that doesn't mean that we're not assessing and taking a look at what we can do to make things safer. There were some small differences throughout the public health orders that we need to be able to assess. Transit is essential. We need to be able to keep our economy moving for those that can't work from home, those that need to be able to get to where they're going. Transit right now, when we went through the first kind of lockdown in March, transit slowed down a little bit to the point where social distancing, and it continues to be at this point, still strong on a transit bus. But we can always take a look and see what we can do for transit to see if there's anything else we can do to make it safer. I got a team of transit managers and directors working in our EOC that are just fantastic, and their number one concern is the safety of their riders and their drivers. So we'll take a look, and if there's anything else we can do that's different, we're going to do that. Right now, transit buses are still electrostatically sprayed and disinfected every 24 to 48 hours. We're putting almost a full transit service on, I believe. Still, even though our ridership is down to approximately 40% now is what we're hearing. So it has slowed a little bit with everyone staying home. They're getting the message. But, I have seen those notices as well, Jeff. And mask compliance is 97%. And we need to be able to keep people moving, so.
The other thing I'll just add to that, Jeff, is, that's why the messaging is stay home, stay home. If you need to go out for essentials, if you need to go out for work, keep in mind, a lot of healthcare professionals, they rely on transit to get to and from some of the hospitals in our community. And so it's incredibly important to make sure that they can be transported to and from their place of work. And so if you don't need to go out, obviously stay home. The other thing to keep in mind is we brought in measures much earlier than required, especially masks. Back in August, we mandated masks in all city facilities and transit as an added measure to make sure we were mitigating and doing what we could to ensure the safety of our transit operators, our public service broadly speaking, and of course riders. We are running buses that are not at full capacity, and we're losing tens of millions of dollars. And thankfully, because of the financial support of the federal government, they're providing significant assistance with some of their new dollars that have been recently announced. But part of the way in which we are assisting the province, not only help keep the economy moving, but also ensure that we can protect people's health, is also to ensure that those buses are being cleaned, that the buses are operating, and that the masks are being required as they are in other jurisdictions right now.
Joyanne from Winnipeg Free Press.
Hi, so the second business ticket for being open when ordered to be closed, what are the details of that one?
Business was called, I hope I don't mess up the pronunciation, Serratus Movement Center on Henlow Bay, fined $5,000 for being open when ordered to be closed.
And I guess, is there feedback coming in from businesses on confusion around the orders or anything around that, or what kind of feedback are you getting?
No, I think I think our provincial bylaw officers have been working very, very well with our city bylaw officers have been working very well with their counterparts in the province under the direction of their leadership team over there in the province. They're working really well together, and it's clear what our orders are. Our orders are to enforce businesses that should be closed, and to help with enforcement and enforce orders that where there are capacity limits, like some businesses are allowed to be opened with certain capacity numbers. So we're doing that, and I think the orders are clear. If you're told to be closed, there's lists. The province has done a great job in terms of making sure that those lists are up there, and we're following that, and we're going out on our proactive routes. And unfortunately, I think people will come around. Enforcement is pretty good, and people are complying for the most part, but there's going to be the odd person that isn't. So when that happens, we will issue a ticket.
Sean from CBC.
Have you considered adding more bylaw officers to the complement to ramp up enforcement?
Short answer is yes. We're always speaking with the province and taking a look at what their needs are, collaborating on a daily basis, and we'll see where we can help. We want to be helpful. We want to help everyone get through this this code red and flatten the curve. So the answer is yes. If there's an ask, we're going to listen, and we're there.
And with respect to particularly social distancing or physical distancing on buses, anecdotally, I can say I've been on several buses in the last few weeks where there's been standing room only, and the distance between people is minuscule. And I've got a message from someone this morning who's a driver and is deeply concerned that there is not enough physical distancing on the buses. Can you review how you're monitoring this and say how you know that the physical distance rules on the buses are being adhered to?
I'll just start by just reminding you we are operating in accordance with the requirements of Manitoba Health. With that, Jay can answer your question more directly. Sean.
So Sean, a couple questions back about transit. We said that we're continually looking to see, we've just gone through the new public health orders to see what impacts they may have on city operations. We've got a bunch of leaders in our transit management team that work with the ATU as well as our Emergency Operations Center. Our goal all along has been to protect our residents and our staff. We have transit shields deployed. All drivers are wearing masks, 97% mask compliance. We're running buses that primarily, and I do recognize that on occasion you're going to pick up on a bus like you had mentioned. I'm not denying that there's going to be the odd bus that's got a lot of people on it. But by and large, our ridership numbers are down significantly, and there is ample space on the buses for social distancing. But there are those one-offs, and we do have procedures in place to be able to add additional buses when we see that. They do a bit of a hopping routine where they have additional buses following behind when they see a bus is over full. What I can tell you is that we're continually working with transit to be able to see what else we can do. We've got masks that can be handed out at different locations, and right now it's going well. But we'll take a look and see what else we can do moving forward.
Alicia from Global.
No further questions.
Sorry, Alicia, I muted you by accident.
No further questions.
Sorry. James from the Winnipeg Sun.
Yeah, Mr. Mayor, the Winnipeg taxi industry issued a press release today calling for government intervention, financial support. I can't remember what happened to the conversation that took place in council about that issue, but is there any possibility for help for the taxi industry?
I haven't seen that news release, so I'm not able to provide comment on it yet. But yeah, council decided to provide some relief to them. It was modest relief a couple months back, and so we can get you the disposition after this press conference in terms of the support. It was modest, but it was industry specific.
Thank you.
Yeah, no problem.
Jeff from CTV.
Yeah, Jay, if you could just, sorry, I can't write fast enough, sorry. The number of passengers on buses right now, is it 40% capacity or is it down 40% right now?
We're riding at about 40% of normal operations.
Okay, that's passengers you're talking about.
Correct.
Okay, and I know you said you're almost close to full operations of buses running. Do you know what percentage you're at, the city's at? And
I don't. We can look to get you that information in terms of what full capacity. I know that we'll get back to you on it. I know there were some differences around universities and things like that, but just because everyone's staying home. But we'll get you the full details.
Thank you.
Joyanne from Winnipeg Free Press.
So for the personal care homes, I know obviously there was an ambulance stationed at one for quite a few days. Has that practice ended now, or is the city still helping out with that situation?
Yeah, we're still helping out when required. I don't have specific details on what we did there in the last 24 or 48 hours, but we are still helping out. We are part of the task force to be able to support the personal care homes, and we're listening. And when we get an ask, we do our best to absolutely respond and be collaborative.
So what does that mean? And does that mean you just would come if called, or is there still an ambulance stationed at any of the care?
I believe we've scheduled ambulances to be there over the last 2 days, but I don't have the exact amount of time they were scheduled there for or what services they provided. But I do know that we are still actively engaged in working with WRHA and Shared Health to protect the residents in the Maples personal care home.
You don't have any details on that, though?
No, I don't have the report from last night in front of me to let you know exactly what or if we transport. I don't have any details at all right now. But we can see if we can get that info to you right away.
Sean from CBC. Sean from CBC.
Sorry about that. I'm good for public health questions, but I do have a other question for the mayor afterward if there is a couple of minutes.
Yeah, we'll hold that to the end. Thank you, Sean.
Thank you.
James from the Winnipeg Sun, did you have anything further on COVID? Can't ask you because you have left the call. Jeff from CTV, did you have anything further on COVID?
No, I'll wait till the questions after.
Okay. Joyanne, did you have anything further on COVID?
No, I do not.
Okay. I think then we can let Jay.
Thanks very much, Jay.
Head out.
While Jay's leaving, I want to note it's World Kindness Day, and I want to do something unusual. I'm sure this may surprise members of the media to have a politician say this, but I want to say thank you for the work that you do. Thanks for all the reporting you're doing. I know you guys are working under really stressful and unusual circumstances as well, and your reporting and your questions are helping communicate the public service announcements that Jay and I are providing on an almost daily basis, as well as other officials, and hope you guys get a chance this weekend to rest. So with that now, before you ask me probably more difficult questions, I wanted to get that out of the way.
Okay, we'll start with Sean from CBC.
Mr. Mayor, the this is going to be a softball for sure because you certainly trumpeted this in the past, but the Harvard-Bloomberg initiative is out. Yeah. I read the vast majority of the report. What do you think?
I'm really grateful for the input of so many stakeholders that have contributed to the efforts to date. It's a lot of people for many years have been asking that we look at how we dispatch calls for service, and if there's some innovative ways to get better results for the individuals at the other end of the phone line, as well as look at it from a costing perspective. So I'm really encouraged by the administrative report. I'm grateful that I'm really happy I was able to bring in the dollars and the expertise from Bloomberg and Harvard, and really grateful for the work of so many people that have done the heavy lifting with Bloomberg and Harvard. Obviously, we want to see this report go forward, and then there's a lot of additional work that has to happen, when and if it's signed off by council to operationalize things. So this report doesn't immediately begin operationalizing it, but it does set us on that path to make some pretty significant and I think progressive and positive changes moving forward. That are just a smarter way of providing the supports to people that need it in our community. So I'm really encouraged. This has been a busy year, and especially in the midst of the pandemic, to continue to work and move this forward has been good.
You mentioned heavy lifting and a lot of work to do, and it really is. I mean, if you read the report, this is a giant amount of work. Are you committed over the next year and a half, 2 years of final time in office to see it pushed through? Because you have to sense that there are a lot of silos and a lot of barriers to actually make this happen.
Yeah, and that's why, I mean, this work and the financial and kind of human resources that were lended to the city of Winnipeg, again, at no additional, like, didn't cost taxpayers anything. This is money we brought in from international dollars and expertise. You know, it was through a collaboration stream that was offered. So mayors kind of pitched their ideas, and the Bloomberg Harvard group said, you know what, this is something that could be applied, and not only in Winnipeg, but could be scaled in other communities around the world. And so different application, but you know, it does take a number of different silos that cross different jurisdictional lines to be able to work together to even get us to this point. I mean, that is a measure of success. This involves provincial agencies and city agencies and different silos within government. The true test will be whether or not that political buy-in can be there, not just from city council, but from other levels of government. I think there's a window of opportunity right now, and I think that there is alignment on the intent of this initiative with all of the relevant stakeholders. So I'm optimistic that we might be able to make some really significant changes. And to answer your question, Sean, absolutely. I mean, you're stuck with me for a couple more years. We got a lot of work to do, and this is one of them that I'm going to continue to lead and support.
Alicia from Global, did you have any further questions?
No, I don't.
Nice to see you, Alicia. I don't see you all the time on these. You're on a big screen at the back of the room here, so it's good
Hi, Brian.
good to see you.
You too.
Jeff from CTV, anything?
Hi, Mr. Mayor, are you okay with the North District Police Station going back to the old X grounds and the new design?
Yes, and I want to thank the Winnipeg Police Service. I want to thank all of the community stakeholders that participated in the dialogue that's happened to date, as well as members of council. There have been a number of councilors that have been engaged on this file, and you know, this is the last of the district police stations to be phased in, and an area of the city that I think should have the benefit of a modern presence like other areas of the city have. And so I want to thank the Winnipeg Police Service for their work, and the chief in particular. I know this has taken some time to get to where we're at, but yeah, I do plan to support the administrative report and recommendation from our public service.
Thank you, I'm done.
Okay. Joyanne?
I'm all right, thank you.
Okay, Sean, did you have anything left? Are you good?
I think that covers it all for today.
Okay.
Okay.
Thanks, and stay safe, Mr. Mayor.
Yeah, thanks guys. Thanks for all your work. Have a safe weekend.
Thank you. Bye.
Thank you.
Okay, thanks guys. Have a good weekend.